On Wednesday, Tanzania's President, Samia Suluhu Hassan, is scheduled to get her COVID-19 vaccine, marking the official launch of the country's vaccination campaign. It's a stark contrast to the country's COVID stance earlier this year. On February 2, Health Minister Dr. Dorothy Gwajima stood before press cameras with her deputies. They all drank concoctions containing ginger, garlic and lemons to assure the public that the best way to beat the coronavirus was through natural remedies. The government has no plans to receive COVID-19 vaccines that are being distributed in other countries, Gwajima told the press conference. It was part of President John Magufuli's position that no vaccines were necessary. You should stand firm. Vaccinations are dangerous. If the white man was able to come up with vaccines, he should have found a vaccine for AIDS by now, the president said live on national television at a gathering at his home village, Chato, on January 28. Tanzania was one of the 4 African countries that was not interested in vaccinating its citizens, along with Burundi, Eritrea and Madagascar. This anti-vaccine stand was a marked contrast to Tanzania's previous record on vaccines. With a 99% coverage of child immunization, Tanzania was ranked among top 10 countries in Africa in 2014 for high vaccination rates. It was hard to make sense of this vaccine turnaround. The medical journal The Lancet offered this explanation. 6 months later, the president himself is dead. Heart disease is the official cause given for his demise on March 17 at age 61, although rumors spread and were denied that he himself had contracted COVID-19. And the new leadership has reversed the anti-vaccine stance. On June 12, Tanzania submitted a request to the global COVAX program, which is distributing vaccines to low-resource countries. Prime Minister Kassim Majaliwa announced on July 21 that the East African nation has started receiving the vaccines. The first batch, a shipment of 1 million doses of Johnson & Johnson vaccines, was donated by the US government. People should get ready for vaccination, he said in a government statement. The country goal is to vaccinate 60% of its country's population of 58 million, prioritizing health workers, according to a Ministry of Health statement on July 22. There is no explanation of why that percentage was set or what the timeline is for achieving this goal. Skepticism vs science. Public health officials worry the months of denial and misinformation will have consequences, that many Tanzanians will not step up to receive their jab. Things change so suddenly. I know many people who are still trying to reconcile themselves to the government's new COVID approach, says Heri Makweta, a health reporter for a Swahili daily newspaper, Mwananchi, based in Dar es Salaam.